All right, excellent. Thank you to everyone who's joining myself and Libby from Bodytrack for this webinar where we're going to be taking a deep dive at the foot function, fascial lines. This is a webinar that will be recorded. So if for any reason you happen to lose connection or you want to re-listen, please do note that this will be recorded. You will also get access to this PowerPoint, which will be associated with that recording. Now, as we go through the content, we will spend some time at the end going over any questions. So if you have those, you can type those into either the chat box or the Q&A. We'll be looking at both of those when we answer our questions. And we hope that you enjoyed this. So we're going to get started jumping into foot function and fascial lines. Myself, I am Dr. Emily Splichal. I am a functional podiatrist, human movement specialist. I am in private practice, not in New York City. I have to update that. I'm now in Arizona. I'm the founder of EBFA Global, which is an education company that looks at human movement and movement optimization from a sensory perspective, from a fascial perspective, which we'll be taking that exploration today. And then I'm also the CEO and co-founder of Naboso. Now, this webinar is sponsored by both Naboso and Bodytrack Metrics, which we will just be briefly mentioning to the end about both of these companies and how you can learn more about them and how they could be an advantage to your patients, athletes, and clients. So why feet? Why are we doing a webinar speaking about feet, and how does that relate to function? So your feet are obviously extremely important. You can think of your feet as your foundation, your biomechanical foundation to your structure upwards. So if you do not have a strong foundation, similar to the foundation of a building, if that foundation is not stable, the rest of that structure will have a hard time being stable. So when we look at pronation, supination, unlocked foot, locked feet, it's going to affect the tibia, the femur, the hips, the pelvis, and then the way that energy is transferred higher up that chain. Now, biomechanical approaches to foot function is extremely powerful, but I also want you to understand and appreciate that there is this sensory side to the foot. This is the side that we are going to focus on primarily because it blends into those fascial lines. And it is also the approach that we take both at Naboso and Bodytrack. So this sensory gateway to movement, your feet are continuously reading the ground, reading every single step that we take. And if we're taking on average 10,000, 15,000 steps a day, very few of those steps are going to be exactly the same, which means that you need to be continuously reading and adjusting for each of those steps so that you properly stabilize and you properly load the potential energy from the ground. So this sensory gateway from the feet, will be taking a deep dive even more. So now outside of the feet, why fascia? Well, your fascia is very powerful connective tissue. I like to think of your fascia as an extension of your brain. And the reason that your fascia is an extension of your brain is because it is packed with sensory nerves. So already we have sensory feet and we have sensory nerves within our fascia. That relationship is really important to appreciate when you're looking at the optimization of movement and athletic performance. So there are over 1 million sensory nerves in our fascia. And a majority of those nerves we will see actually play a very important role in the way that we connect to our body. They're actually called interoceptors. So your visceral fascia and your emotional side of movement is actually deeply connected to your fascia. So another thing about your fascia that relates it to the sensory side of movement is that fascial connections are going to be fast. Fascial connections are fast. So when we take this exploration, looking at foot to core sequencing or our lateral line and how we stabilize for a single leg stance, those fascial stabilization pathways are very fast. So when you can optimize a fascial pathway, you are then going to be preparing the stabilization patterns in your athletes or individuals to be more pre-active or anticipatory. This is exactly the way that we want to move to optimize performance and reduce injury risk. Foot fascial connections, outside of being fast, is that they are sensory driven. Makes sense, right? We have 1 million sensory nerves in our fascia. We have hundreds of sensory nerves in the bottom of the feet. They are sensory gateways into our brain or into our nervous system. Foot fascial connections are integrated, of course, right? Your feet are part of your core. That is an integrated pathway that we want to make sure that we optimize because it blends into the next one, which means it is functional. So to functionally stabilize the body, we want to be thinking about it based off of how we transfer energy. And that has to do with what your foot is doing on the ground and how you are stabilizing or relating to your center of gravity. So your center of gravity, your center of mass, and how you relate to shifts in there is directly related to how you are stabilizing and relating to the ground below you. Foot fascial connections are based off of tension. So this is also really important, that this concept of tensegrity, integrated tension, you bring that integrated concept back into it. Now, fascial connections, because they're based around tension, is really, you could think of it almost like your soft tissue skeleton against gravity. And yes, we have postural muscles, but because all of our muscles are wrapped and surrounded in fascia, every muscle group and fiber and fibril is surrounded by fascia. So muscle contractions influence fascia, and it is our myofascial web that is really resisting gravity, and that is a sensory experience as well. And then finally, foot fascial connections are going to transfer to gait. So walking or bipedalism is the most functional move that we do every day. So if we can transfer something, a pattern that we train to gait, that is the epic of functional transfer, is trying to bring it back to gait. So let's talk about gait. When you are trying to optimize your clients, your athletes' foundational functional movements, when we're thinking about the foot, right? How do we optimize how it transfers to gait, to walking, to bipedalism? Is 3 main ways. So when we walk, we need to be able to absorb impact forces. I'm actually going to switch these around, so I apologize. So shock absorption is going to go first. So we are walking, we're striking the ground. Every time your foot strikes the ground, regardless of the part of the foot that strikes the ground first, you are experiencing ground reaction forces. Those ground reaction forces are a relationship between gravity, the pressure of gravity, and the ground itself. So our foot's gravity relationship is ground reaction forces. You strike the ground, you get these ground reaction forces. Those are your body's energy to take the next step. Now, it is our choice to work with those ground reaction forces, to have a symbiotic relationship with them, to bring them in, store them as potential energy, and then to release them as elastic energy. That is a fascial sensory foot fascial pathway. Now, outside of shock absorption, the next function of your foot is going to be single leg stance. So our ability to stand on one leg was a pivotal change that happened evolutionarily for us to walk on 2 feet. It is an extremely functional position. If we start to lose our single leg stability, we then change the way we walk. We cannot take as long of strides if we do not have single leg stance. So as someone's balance starts to compromise and they lose that skill, that ability to stand on one leg, they have no choice but to shorten their strides. And then that has an effect higher up the chain as far as how we get these reciprocal patterns between the T-spine and the pelvis. So single leg stance is really, really important to the mechanics of gait. And like I said, stride length. Okay. And then your final phase or function that we want out of our feet is, if we're walking, we want to go somewhere. So there is propulsion, or you could even say forward progression. So forward progression when we walk is based off of our foot's ability to become what's called a rigid lever. So if you were to do a calf raise, even if you're seated, if you do a calf raise in your chair and you look at your feet, that position that your feet are in right now is called a rigid lever. So our ability to achieve that position is what allows us to go forward when we walk, that forward progression. So again, just real quick summarizing. So we're looking at the foot, and the way that I want you to train the foot when you're thinking about programming is train the foot to be a rapid anticipatory shock absorber. That is through rapid isometric contractions. Isometric contractions create a stiffening response, increases compartment pressure of the foot, and you are able to bring in the potential energy and store it in your connective tissue to be elastic energy. So that's something you want to train the foot to do. Single leg balance and stability. Obviously, you're doing single leg training. Get your short foot going, get your digits contracting, get your toe flexor strength up. All of that is going to improve single leg stance. And then finally, you got to train the foot to get to a rigid lever. That means that you are getting across all your MPJs. You're rapidly supinating your rear foot to optimize that rigid lever. And don't worry, we'll be taking a deep dive into these in even more detail. So let's look at this. Your functional foot. How do you achieve that functional foot so that you can absorb impact and stand on one leg? Here, this is referred to as a plantigrade foot. So we are achieving a plantigrade foot. So your foot, when it is flat on the ground, is called plantigrade. Okay. Now a plantigrade foot is going to be identified by its foot tripod. So if you are centering your mass over your foot, you are centered over your tripod under the first met head, the fifth met head, and the heel. So the first, the fifth, and the heel. Some people will say a quadrupod, which means they're also pushing the hallux down. Okay, you could do that. I personally, when I reference short foot, I actually want the first metatarsal head to lift, and I'll go into that in a moment when we press forward into the rigid lever. But a plantigrade foot is a tripod foot. Okay, now that tripod foot is linked to what is called the reverse windlass mechanism. Now, I don't know if any of the listeners are familiar with what that is. You probably have heard of the windlass mechanism. The windlass mechanism is actually applying towards or referencing the rigid lever, so the push-off phase of gait. But the reverse windlass, a little bit different. So I'm going to first just tell you what the windlass is. The windlass mechanism, if you join me for a minute, if you put one hand on the bottom of your foot, and anytime you're talking about the windlass mechanism, you're talking about your plantar fascia. Okay, so my hand is in the bottom of my foot. I feel my arch, my foot is relaxed, and I know my plantar fascia is in there somewhere. I just don't know where it's there. So I'm going to put my hand on the bottom of the foot. I'm going to take my digits, my toes, and dorsiflex them. As soon as I did that, if I put my hand on the arch, I can feel my fascia just tightened. It popped out. So now I can palpate along my entire fascia. So what the windlass mechanism is when you dorsiflex the MPJs, you tighten or pull the plantar fascia, which originates on the heel, which inverts the heel. So dorsiflexion of the MPJs tightens the fascia, inverts your subtalar joint, and locks the foot. This is essentially what happens when you go into your rigid lever, which if you do that again, even sitting in your chair, you can see that you just technically activated the windlass mechanism. It's a way that you stabilize the foot and the way that you potentiate more energy during the push-off phase. Your reverse windlass mechanism is going to be a little bit different. This is how you stabilize your foot when you are standing on the ground flat. So when you stand on the ground flat, let's say you're balancing on one leg and one foot, you want to make sure that all 5 toes are touching the ground. That is called purchase. Toe purchase is how we stabilize on one foot. So you don't really balance on your tripod, right? You're not balancing on your met heads. That's not the purpose of them. Your digits are how you balance and stabilize when you stand on your foot. So the digit purchase, or connecting the toes to the floor, is a mechanism of your plantar fascia. It actually pulls the toes down into the ground, and that extension into your digits is technically called your plantar plate. So your plantar plate under the toes pulls the toes down and maintains purchase. Okay, toe purchase, blending into this. You can see this picture here that person does not have good purchase. So they are not activating the reverse windlass mechanism. Technically, you could see that this has a direct correlation to decreased stability in a single leg stance. If this was a senior, that definitely would contribute to a fall risk. Okay, so these are things that have to do with athletic performance, but you, of course, could tie this into other applications with clients such as fall risk. Now, another characteristic of a plantigrade foot to balance on one leg and function optimally are going to be your arches. So we have arches on the outside of the foot, and we have an arch on the inside of the foot, your medial longitudinal arch, your lateral longitudinal arch. And these arches are really important to the stability of the foot, the ability to load what is called arch compression. So every time we move dynamically, your arch compresses slightly, hence the name arch compression. And when you do that, you prime the connective tissue. And then when you pick your foot up, all of that connective tissue comes back in, the arch lifts, and you release elastic energy. So it's really important to, again, energy transfer and movement efficiency. I will reference how the arches influence the rigid lever in just a moment, though. Now, also, in addition to your longitudinal arches, we have a transverse arch, and the transverse arch is going to be across your metatarsals. Your metatarsals give a little bit of a lift underneath them. And what's really important to understand with the transverse arch is that we actually don't really bear weight on our met heads. So when I teach short foot, I do not teach people or cue people to push the first met head down, because these are not really weight-bearing bones in the body. A great analogy would be if you were in a half kneeling position. So let's say I was on a half kneeling position with my right leg back and I was on my right patella, right? I'm on my right kneecap. For people who are passive in their body and kind of susceptible to gravity, if you do that position, and let's say you're doing like a hip flexor stretch, they'll often be like, oh my God, that kills my knee. Like I'm just like on my patella. That's not the way that you're supposed to do that. In a half kneeling position, you are supposed to engage, put some tension in your fascia so you're lifting off of your patella. So you don't have dead weight kneecap. Same here. You're never dead weight met heads or dead weight sesamoids. You have tone and tension in your foot to maintain these arches. Okay, so that arch is really how you balance force, and it also applies to the rigid lever, which I will speak about momentarily. Okay, so that was your first function, is can your foot achieve a plantigrade? Do you have a good tripod? Do you have toe purchase? Can you activate the reverse mechanism? Do you have your arches? And then from there, you are able to achieve single leg stability, or you should be able to achieve single leg stability. If we look at the second function of the foot, this is going to be that shock absorber. So the foot that can absorb the dynamic impact forces. So to understand this concept, we want to appreciate that we perceive impact as vibration. So every time the foot strikes the ground, you are experiencing vibrational forces going through your foot. The way that we absorb those vibrations is going to be, sorry, let me go back one. The way that you perceive those vibration forces is through your foot mechanoceptors. So these are the nerves in the bottom of the foot, in the skin in the bottom of the foot. And it is through these mechanoceptors that you perceive different stimuli, such as vibration, skin stretch, and 2-point discrimination or texture. So Naboso and all of our products actually stimulate the plantar foot mechanoceptors. Vibration is just another stimulus, where texture or 2-point discrimination. Now, these mechanoceptors in the bottom of the feet, These that are sensitive to vibration are also found in your myofascial web. So they're found throughout the foot and the different connective tissue layers of the foot, but they're also found throughout your legs and the rest of your body. They're an important mechanoceptor fascially as well, because movement is vibrational and it allows your entire body to perceive that vibration. Okay, so now this is the way that you load those vibrations. So you're able to perceive the vibration through the mechanoceptors of the feet and the fascia. How do you then absorb or damp the vibration to then store it as potential energy? And the place that we store vibration or impact as potential energy is in our fascia, right? So there's this relationship. So your fascia is able to store potential energy through a muscular response. Okay, now to explain this, if you've never heard this before, then tune in now. Okay, if you've heard this before, then let's just do this as a review for you. So if I have a tuning fork and I strike the tuning fork and the tuning fork is vibrating, how would you stop or damp the vibration of the tuning fork? And if you're at home and you're screaming, you would touch it, right? You would contract against it. You would stiffen against the tuning fork so it cannot vibrate. I want you to take that exact same concept and apply it to your body. How do you stiffen against vibration with the ground? You would create some sort of contractions. You stiffen a muscle contraction. That muscle contraction is going to be isometric. Now, isometric contractions, all contractions have an influence on your fascia, but isometric contractions specifically have the highest response or potentiation of fascia. And the response that it has on fascia is going to be tension. Okay, and you could just try that where you are and say, oh, when I engage my TVA and my core isometrically, I feel tension, stiffness, right? Now, what you're also experiencing when you contract your muscles isometrically is you actually experience also pressure. So all of the muscles in the body are housed in these or organized in compartments. And when you contract the muscles in a compartment, the pressure goes higher. So a rapid isometric contraction creates fascial tension, fascial stiffness, but also increases intracompartment pressure. That is your goal. And that is the way that you want to train the foot to be a rapid stiffening mechanism, but then it also quickly relaxes. Okay. Now, finally, the third and final function of the foot we're going to focus on is the rigid lever position. Now, your rigid lever position, which we all know what that is, that allows us to go forward. That obviously means that we need to be able to get through our big toe, all of your MPJs, but especially that first MPJ. Now, your first MPJ is very closely related to another joint or axis that is called your first ray. Now, your first ray is actually your metacuneiform joint. So if you look at this image here, you can see the big toe. This is your metatarsal, and then this is going to be your cuneiform. So that cuneiform metatarsal joint right there, you can see that. That is your first ray coming forward into the big toe. Now, every time you dorsiflex your first MPJ, you plantar flex your first ray. I just want to lightly touch that, and then we take deep dives in that in all of EBFA's education. So we must be able to plantar flex that first ray to get through our first MPJ. Now, what also happens as we shift forward into our lever, as you need your foot to open up. Your foot actually spreads, it widens, it splays as you shift into a rigid lever. And the splay that I'm really referencing is metatarsal splay, not toe splay. Toe splay is great, but really what I'm concerned of more from a foot fascial perspective is metatarsal splay. I want those met heads to open up and spread. And then that triggers the sensory nerves of your fascia to stabilize the foot, and boom, we are releasing power. Okay, now if you were to assess met splay in a female, you need 3 millimeters of a splay. That's kind of optimized through research. And then men need 5 millimeters of a splay. So if you're looking at shoes and you're trying to size shoes with the toe box, is you always want to make sure that women have enough room to get at least a 3mm splay, and then 5, you need at least a 5mm splay. Finally, when you're looking at the rigid lever, we obviously need to make sure that that rear foot is inverted and locked. That is technically the windlass mechanism, the traditional windlass mechanism. And that made the foot stable, and that potentiated the plantar fascia. Okay, so that is our foot so far. We understand our foot from hopefully a mechanical perspective, from a sensory perspective, why your fascia is super important, why we want to start appreciating the foot fascial connections. And then if we just step back a little bit and look at the 3 primary functions of the foot for gait and functional movement, we've got that single leg stance, that shock absorber, and that rigid lever. You want to create your programming around that deep understanding. Now, if we go back to the fascial lines that connect in the foot, the bottom of the foot, there's going to be 3 main ones that we want to appreciate. We've got our deep front, our spiral, and our lateral. And these all relate to those 3 positions or functional demands that I just went over. So we're going to start with the deep front line. Okay, your deep front fascial line runs from the bottom of the foot, the tips of the toes, up through your posterior tibialis into your adductors, the pelvic floor, your diaphragm. It comes up your neck and it goes to your tongue. So your tongue to palate is a great way to stabilize your core and your feet. Okay, so this is your body's central skeleton for stabilization patterns. Now, in EBFA's BTS certification, or a barefoot training specialist certification, we go into this foot to core concept, and all of the stabilizers that we look at in the core, we start to differentiate them as local stabilizers and global stabilizers. Now, there is an order that these muscles should be contracting. You want your pelvic floor to contract before your obliques. You want your obliques to contract before your rectus abdominis. You want your pelvic floor before your glutes. You want your pelvic floor before your psoas. So there's kind of this order in how you want these muscles to stabilize and contract in relation to each other. You can take that exact same concept to fascial lines. And I consider the deep front fascial line to be a local stabilization line that should contract first, and then your other fascial lines that you know from Thomas Myers and anatomy trains are going to activate after your deep line engaged. I hope that that makes sense. Okay, and then your programming should support that. Okay, so when we engage the deep front line, this is through short foot. So short foot activation. And short foot is going to be the mechanism of essentially pushing your toes down into the ground. And when you do that, when you push your toes into the ground, you should feel your pelvic floor lift. Now, I had said that when I teach short foot, I like to teach it where you lift your first metatarsal head up. So I want to briefly just take a 2-minute intro to short foot for those that might not be familiar with it. Or if you do it now, maybe there's a slight little pearl that you can pull from this. So try to listen to some of the subtle cues that I teach as well when I do short foot. But this is how I break it down. And while I'm moving my camera over here, I'm going to have you guys just kind of read through that. And you can see that I like to do 1 foot at a time. I like to keep the knees soft. And the reason why I do that is because that when we do short foot, we create a locking mechanism up the leg. I'm actually going to emphasize and cue that you're going to lift up off of that first metatarsal head, and then we're going to connect our feet and our core. So I'm standing on a Naboso mat just so that you can see my feet. Obviously, if you're bringing in sensory information, you get even more out of your foot, but I'm going to have you stand up and join with me as well. And if you're familiar with short foot, this will take just a moment and then we'll continue. So I like to do 1 foot at a time. So I'm going to bring my right leg forward and my left leg back. I'm going to slightly bend my knees. I'm going to find my foot tripod, lift my toes, spread them out, place them back down onto the ground. Now, when I push my toes down into the ground, I'm using about a 20% strength. So 20%, I'm just saying hello to my foot, and then I'm going to release it. Again, I'm going to push the tips of the toes down into the ground, 20%, and then I'm going to release. And then we could do that one more time. Now, if you look at the side of my foot, if you can appreciate that, every time I do short foot, you want to see that I'm actually lifting off of my metatarsal head. So I'm lifting and then I'm releasing. I'm lifting and then I'm releasing. Okay. If we went to the other side, we would start that exact same way with the knees soft, the foot tripod, we're spreading the toes, and then we push the tips of the toes down into the ground, knee stays soft, 20%, and then I release. Toes go down, 20%, hello foot, and release. Okay, so we do a couple times on each side. My next progression, I would go to the first side, assume that exact same position. Now, before doing short foot, I'm going to have you engage your transverse abdominals and your pelvic floor if you know how to do that. So engage the core, hold it, and now push the toes down into the ground. Hold both. Can you feel that connection? Can you appreciate how they are talking to each other? And then good, let's relax both core and foot. Let's do it again. Engage the core, hold, push the toes down, hold, and then just stay there. Let's push our toes down harder. Do you feel your core engage more? Or engage your core more? Do you feel your foot engage more? And then release both. So now we're getting both parts or two parts of the deep front line activated throughout this. Let's quickly go to the other side and we have one more addition and then we're moving on. Same position, spread the toes, engage the TVA, engage the core, push your front toes down into the ground and hold, stay there, appreciate it, beautiful, and release. Do it again. Engage the core, hold, push your front toes down on the ground, hold there, push the toes harder, 4, 3, 2, and release. Perfect. One last addition and then we're gonna move on. So your front leg went forward, knees are soft. Here we go. So now we're going to add on all the way to the tongue and the palate. So I'm going to have you engage your core, hold, engage your front foot, hold. Now push your tongue into your palate and hold. Stay there. Now release it all. Let's do it again. And I'm going to cue you through it because I'm talking. I can't put my tongue to my palate. So engage your core, hold, push your front toes down, hold. Let's actually add on, push your back toes down. I know we didn't do this yet, but let's do it. Hold it, feel that tension, push your tongue into the palate, boom. Hold, do you feel stable, locked in? And then release, perfect. You can repeat that exact same thing on the other side. And that's really how I like to activate and start warming up. That's of course your 5-minute demo to that. I speak about it much more in other EBFA education, but short foot is going to be your deep frontline activation. We do it with intent. We do it progressively. We do it understanding that we are building fascial tension. And then eventually you want to do that rapidly because it's short foot that technically how you create a shock absorber in your foot. So we don't want to be just thinking about short foot and you hold it for 5 seconds, or you do it under load, or you do it when you're doing squats, but you want to be doing ballistic movements, rapidly contracting the foot and creating a rapid relaxation to follow that. And when I say contraction of the foot, I mean foot to core. Every time your foot contracts, your deep core pelvic floor needs to contract, okay? And technically you need to add in your breath, which we didn't emphasize here, but we definitely do. Okay, so that's your deep front line. That's your local line. That is your stabilization pathway. Now your lateral line is going to be the next second fascial line that connects to your feet. This is going to be formed by your peroneals, which run along the side of your foot through your IT band into your abductors. And the purpose of your IT band is to stabilize your knee in a single leg stance. So single leg stability, lateral line, pelvic, lateral ankle stabilization. So the timing of activation of the lateral line is obviously going to be extremely important for dynamic athletic movement. Now that transfer is based off of a single leg stance. Now I'm going to speak briefly about the spiral line, and then I'm going to tie these back to the deep front line. But I have to emphasize something with the peroneals first. Okay, so let's go into your third fascial line that we're focusing on. We have our spiral line. So now your spiral line, if you can see here, this is formed by the Peroneus longus in the bottom of the foot. This right here, what is this? This is your first ray. So on the plantar aspect of your first ray, boom, you got your peroneus longus. On the dorsal or the top aspect of the first ray, you have your tibialis anterior. So tibialis anterior, peroneus longus on the bottom, they're blending into each other and starting to make that stirrup. It then runs up your lower leg into your obliques, around into your rhomboids and your serratus anterior, and then that's eventually going to have an effect on scap stability for your shoulder. Now, your spiral line, because it inserts on and influences the first ray, it technically influences the first MPJ, which technically influences your rigid lever. Okay, so the way that you are able to get over your big toe is based off of spiral line stability. If your spiral line's not stable, your first ray is not stable, you will not plantar flex it fast enough to dorsiflex your first MPJ. Okay, this is obviously going to transfer to propulsion. Now, let me go back a step. Why this is so stinking cool is you have your peroneus longus. Your peroneus longus is part of your lateral line for single leg stability. Your peroneus longus is part of your spiral line for rigid lever formation or rigid lever stabilization. Now, what attaches to your peroneus longus is your posterior tibialis. So if we go all the way back to here, part of your deep front line is your posterior tibialis. And when we go into deep anatomy dives, is we actually see that your posterior tibialis, which inserts on the inside of your foot, this muscle actually fans out and it attaches to 9 different attachments. And one of those attachments is your peroneus longus. This means that your deep front line, post-tib, attaches to, inserts on your spiral line and your lateral line. This from a fascial connection timing, fascial lines are fast. The faster you can stabilize your foot from a deep front line perspective, the faster you will be able to activate and stabilize your lateral line as well as your spiral line. So one leads into a rapid stabilization of the next. So that is why I'm such a believer of foot core fascial connections via the deep front line and short foot and rapid foot isometric contractions, is because it is the driver of all of these other fascial line stabilization pathways. I hope you find that as cool as I do, because it is so powerful, so powerful. And that is really the premise of everything that I speak to through my EBFA or my patients, is how powerful the foot is from an integrated perspective. So I hope that that brings some intrigue, some excitement about the foot, a curiosity to explore this even more. And then really, if you are looking to optimize the foot timing, so that everything is about timing. So the timing and stabilization of the foot, and try to trigger that deep front line activation even faster, my go-to is you got to turn the volume up to the sensory stimulation of the foot. And honestly, that's why I developed Naboso, as I was teaching barefoot training all around the world and teaching coaches and trainers on how to optimize timing of the foot. And being barefoot is great. Being barefoot is awesome. But are there certain things that we could do to our surfaces to actually enhance the timing of that foot activation even more? And that's where I started researching texture and the nerves in the bottom of the feet. And then what also happens to the timing of the foot as soon as we put on our shoes? Well, of course, your foot is going to become a little bit slower because of the cushion and that disconnect from the ground and the sensory stimuli. So that then evolved to the Naboso mats, Naboso flooring, if you're barefoot. And then in shoes, it's our insoles to, again, just accelerate timing. Everything is about timing. So if you are new to Naboso, I encourage you to head to our website. All of our products are visible here. All of our products carry a 2-point discrimination material. And for those that are familiar with Naboso, thank you so much for integrating our products and showing your support. But our 2-point discrimination pattern on our insoles, mats, flooring are used with many professional athletes, every sports, and they're also used for those with neurological conditions where we're trying to reduce falls. And we also have various license agreements where we license our material and is built into different products, where Bodytrack Metrics is one of those. And I'm going to let Libby speak briefly about Bodytrack Metrics and how and why they integrate Naboso onto their force plate.
Okay, so I don't know if you can hear me this time, Emily. Yeah, good. Okay. First of all, thank you so much to Emily. It's always a pleasure to listen to and learn from her. We at Bodytrack Biometrics have a really nice synergistic relationship with Naboso, because as Emily mentioned, we do, I think she mentioned, we do have on our products, we use her Naboso sensory stimulation covers on top of our pressure mapping sensor systems. So the nice thing about what we do in conjunction with Emily's work is our entire business is built on pressure mapping. And pressure mapping is just, it honestly, it is the measurement and display of pressure and its distribution. So we have these wonderful mats that have wonderful Naboso covers on them that are used in the healthcare, wellness, and sports world. And it's really a tool to help you as movement specialists and physical therapists and sports performance trainers, coaches, specialists, learn how your patient, client, athletes use the ground. What is their relationship with the ground? So you can, with our systems, you can assess, which means you can, you can do some assessments on our mat, whether it's balance, single leg balance, squat, jump, anything you want to assess to figure out. It basically, it eliminates the visual guesswork of trying to determine if your client looks stable or balanced. So this actually provides you with a visual. It's a terrific tool for enhancing your movement training. And with one of my favorite things, and Emily mentioned it in our webinar last week, is we have a wonderful real-time biofeedback training module. It's really cool. It actually lets you sort of give your clients that visual, which adds another dimension into their training and stability work. It gives them, anytime you can create an awareness of using the ground as a source of power, it just enhances the ability for someone to learn how important the ground is to move energy all the way up through the body. And that's what the visual does with our biofeedback training. I always tell people it's kind of like giving someone an Oprah aha moment. Oh my gosh, I had no idea. Aha, I didn't know I was on the right side, 70-30 when I'm doing my squat. It might look symmetrical, but when you actually see it on a pressure map, sometimes you can't actually see that visually. You might think that they maybe look fairly symmetrical, but when you actually see the visual and they see the visual, it does create that Oprah aha moment. So we love everything that Naboso is about. We love all of Emily's passion and brilliance in the field of sensory stimulation, barefoot training, just using the ground. And that's why I think we have this really synergistic relationship, is because we kind of both are focused on helping people move better by learning how to use the ground. So thanks for listening. Please reach out. You can holler at me. I'd love to give you information about how our system works with Emily's and Naboso's products. Thanks. And thanks to Emily.
Thank you, Libby. So as you guys are thinking of any questions that you may have, absolutely type those in. We'll spend a few minutes going over those. And I appreciate everyone who tuned in live, or if you're listening to the recording, thank you as well for listening. Please do type in any questions that you may have. And while we are waiting for any questions that are out there, I just want to briefly kind of integrate the Bodytrack pressure map, as far as the different functions I was referencing with the foot, it's a great way to see and demonstrate to the individual if they have a symmetrical tripod. So you can actually see their tripod. You can see if there's any hot spots. You can see a little bit from this image here. If you're not familiar with pressure mapping, obviously the red is higher pressure. So you can see, oh, okay, you are, you have a hot spot or a pressure spot under your fifth met head, and you have very little pressure under your first met head. So then that's helping them to see and understand, okay, I'm not on my tripod. Technically, you need to assess and determine why they are not on their tripod. It's not just an awareness you need to bring to this individual. Do they have a forefoot varus? Do they have something else that's going on? So it helps you to understand pathology, and that's how I use it in my office personally. But as you move through some of the different movements of the lever or a jump takeoff and different things like that, that symmetry is really important to gauge in these athletes and individuals as well. So definitely in support of the Bodytrack metric system. All right, so a couple questions for those that are still tuning in to hear some of those questions. Linda has a question. Can this training help someone who has a rigid large toe, compromising plantar flexion, or in combination with insoles? So that is a good question. You are asking about really a hallux limitus, potentially a hallux rigidus, that is addressed differently. So when someone has arthritis in their first MPJ, they're going to have a very difficult time moving through mechanically, or maybe it's just the architecture of their joint from arthritis that they cannot dorsiflex the great toe. So that would be a little bit different. We do go into that in some other courses through EBFA, so you might want to tune in on those. If I go very detailed in this, it might be kind of above some people's heads because there's not context to it. So I would say to check that out, Linda. Rue has a question about open chain isometric contraction versus closed chain. In short foot, we're creating an isometric contraction in a closed chain position. Do you have thoughts on the differences between that and creating such pre-tension isometric contractions in an open chain position? For example, when sprinting and the foot is in the swing phase, getting ready to hit the ground. Great question. So what is actually happening, and I apologize for this, but so the rate at which we experience the rate at which we experience impact forces is actually much faster than your muscles can respond and contract. So all of the muscle contractions that we do in order to stiffen, to absorb impact forces or damp impact forces is actually happening before your foot is even on the ground. So guess what, Rue? Even if you train short foot on the ground, you are training for an open chain transfer because it happens before your foot hits the ground. Some other ways that you could train, it's a little bit different, but other ways that you can train open chain tensioning through the foot is anything when you're hanging or your foot is off of the ground. It does involve plantar flexion of the ankle and engagement of the intrinsics, but you will get an open chain transfer from the short foot. And that just has to do with the neuromuscular timing. Really good questions. Alyssa asks, how long is the better time to use the Naboso insoles? I believe you're asking as far as duration for each use. Technically, we like our insoles to be worn the more the better, meaning that if you need the sensory stimulation, let's say you're an athlete and you just sprained your ankle, you now have a delay in your neuromuscular stabilization. You probably would do better off wearing our insoles the entire time because you want to kind of accelerate that foot awareness. If you were a cleated athlete and you just want to do your movement prep with them on and then not use them in your cleat, it's a great way to neuroactivate. So that's a way that you could use it. Technically, we also look at our insoles as recovery. So once you get the athlete out of the cleat, or you have a long day at the office, or you're walking a lot of mileage, you can use our insoles as a form of recovery. So it could be used as activation, complete integration into the movement, or as a form of recovery. Good question. Good question. Okay. Do you have any opinions about running on your toes regarding proper foot mechanics I'm a physical therapist and have a lot of military clients that have been told that the best way to run. So Carla, that's a really good question. We were actually looking to do a pilot with Naboso with the Navy, with new military cadets, because they have such a high injury rate, such a high foot injury rate and stress fracture rate. And a lot of that could be perhaps from poor mechanics, such as what you're explaining, as well as just the heavy load and the volume, and they're just not used to pushing and carrying the rucksacks around. But my suspicion is that if a military cadet or someone in the military is running with a 4-foot strike with a military boot that does not support that mechanism, that could very well be likely contributing to their injuries. So you always want to make sure that the footwear matches the pattern of the foot. So I hope that helps. For someone with a bunion, is short foot still effective? Yes, that's a great question as well, but you do want to integrate something to help align the toe, meaning like a toe spacer, such as Correct Toes or any other silicone toe spacer to just realign the digits and then do short foot. But when someone does short foot and they have a bunion, it is very difficult because of the deviation of the intrinsic muscles when someone has a bunion. So it's actually really hard for someone with a bunion to do short foot the right way. So I will always have them use a toe spacer. Okay, so I have a couple questions in the chat. I'll do a couple more questions. Actually, there's a lot of questions. Oh my goodness. How does shortening your gait or your stride affect the pelvic and T-spine relationship? Oh my goodness, I could do another lecture on that. So when you take a stride, a long step, your pelvis is rotating medially and laterally. It's hard to tell, maybe my book will open it. So it's rotating like this, right? And then your T-spine does the opposite rotation. So your pelvis opens one way and your T-spine does the opposite. So it's called a decoupling between the T-spine and the pelvis. There's a direct relationship between pelvis and T-spine decoupling and stride length. So if you take short strides, your pelvis doesn't need to open up because you're not taking a long stride, which means your T-spine doesn't have to decouple. So you lock your T-spine, you lock your pelvis. And now when you do want to take a long stride, you are not able to do so without compensating. So there's a very direct relationship to that. So can manual therapy techniques improve the quality of the fascia in response to the foot and fascial lines? Absolutely. Absolutely, 100%. Body work, rolfing, structural integration, 100%. How does short foot and the deep front line relate to pelvic stabilization on a bike? Very good question. So that would be just as important as something where you're closed chain and you're dynamic experiencing impact forces. And we're actually doing a cycling pilot right now with Naboso because there's such a high rate of foot pain and pelvic floor hip disconnect in cyclists who are doing really long rides. So we like to keep people connected to that deep front line through the foot in their cycling shoes, even on these long rides, because your glutes are only as strong as your core is stable and your core is connected to your feet. So we need to make sure that we are addressing those. So we have just one more minute. I'm going to just briefly answer them. And if I missed any of your questions, just please know that you can always email me or inbox me. Make sure you're following Bodytrack on Facebook. I'm not sure if they're on Instagram as well, LinkedIn, YouTube, same thing with Naboso as well. Okay, how do imbalances in the tensional network of the fascia affect pronation and supination? I would say that actually it is pronation and supination that affects the fascial tension. So that is where I like to look at biomechanical influences as potentially affecting the timing of stabilization. In a pronated foot, it's an unlocked foot, it's a hypermobile foot, it's a slow foot or a delayed foot. So foot to core sequencing or deep front line stabilization is actually harder in a pronated foot because it's so unlocked. So that's where I like to teach someone to find neutral, to set their base, and then to do short foot, foot to core on that base, that set base, which is the plantigrade foot. And then that will help them get faster tension through these fascial lines. So I actually look at it a little bit different, although imbalances in muscles affect mechanics in many ways as well. Okay, perfect. I think that is a great way to end. Again, if we did not get to your questions, I do apologize, but do know that you can always reach out to us. My email is dremily@naboso.com. Libby's email is it on here? Thought it was on here. Is this your phone number? I think she is typing it in. Okay, yes. So Libby's email, she sent it just to me, so I will copy it and send it to everyone. You can also go to, here's Libby's email. My email is linked here. And then do follow Naboso and Bodytrack for more information. We do have a golf webinar that's coming up in July, so we'll send that via email to everyone so that you may join us then. I want to thank you all so much for your time and hope that you have a great day or great evening. Thank you all so much.